Hi, everyone. I hope you all are keeping safe during these tough times. I'm Elvis Martin, Principal Ambassador of Youth Development Australia. Thank you for joining Desi Australia. Today, we are talking to the Deputy Chief Medical Officer of Australia, Professor Michael Kidd. Welcome to Desi Australia, Professor Kidd.
Thank you, Elvis. I'm really pleased to be able to join you.
Thank you so much for speaking with us. Our audience has many questions and concerns about the vaccine rollout and the safety of vaccine. Who's better than you to answer some of these questions? So our questions today are submitted by our viewers. So let's get into it. So the first question is, can you please share with us how the vaccine rollout is going and explain the National Cabinet plan to begin opening up our international borders when the vaccine reach 80% of the eligible population? Is this achievable?
Thank you, Elvis. So the vaccine rollout in Australia is going very well. We now have very strong supplies of vaccines, the Pfizer vaccine, the AstraZeneca vaccine, and also from the middle of September, the Moderna vaccine becoming available. At the time that we're making this recording, we have nearly 22 million doses of vaccines which have been administered to people in Australia, and every day hundreds of thousands of people receiving vaccinations. So very strong response in Australia. We have very high levels of vaccination already among older people because, of course, we started the vaccine rollout prioritising particularly very elderly people. And the vaccine rate amongst those over 70 in Australia is nearly 90% of people have received at least a first dose. So I'm very ambitious that we are going to reach our targets of 70% and 80% of the population having received both doses of a COVID-19 vaccine and being fully vaccinated. Now, as you know, the national plan relies on us meeting these targets of percentages of the adult population, population age 16 and above, having been fully vaccinated. And there's a 70% target and then an 80% target. And what we've seen in other countries which are similar to Australia with similar high rates of acceptance of vaccination is these countries have reached the 80% mark, and some of them have gone very significantly beyond that mark. We've been watching what's happened in Israel, in Singapore, in Canada, in the United Kingdom, in many other countries. So as we get beyond these points, it makes it safer to open up parts of Australia because the likelihood of having very significant outbreaks reduces as we have more and more people protected. And of course, what we've been doing throughout the pandemic is making sure that our hospitals have not been overwhelmed, which of course, again, we saw happen in other countries last year. And so we believe that when we reach the 80% vaccinated rate, and hopefully we go beyond that, and then when we start progressively opening up our borders, both internally and internationally, that we won't get very, very large numbers of people who are very sick with COVID-19 needing hospitalisation. So we still have a way to go, and that's why it's really important that everybody gets vaccinated. We have now the Pfizer vaccine available for everybody aged 16 to 39 in Australia as of last week. And over the coming week, we'll be opening up access to the Pfizer vaccination for those aged between 12 and 15 as well. So people will be able to make bookings and get vaccinated.
Thank you, Professor, for sharing that info. The other question that we received was, there are still a lot of people who have concern about the safety of vaccine. We hear about blood clots caused by AstraZeneca vaccine and heart problems caused by Pfizer vaccine. Could you please explain why people should have confidence in the vaccines and get vaccinated?
Yes, so all vaccines have side effects, as most medicines have side effects. Now, fortunately, most of the side effects associated with the COVID-19 vaccines are very mild. And this is the sore arm that people often get after a vaccine, sometimes for a day or two. You can feel quite fatigued, sometimes feverish, sometimes aches and pains. This all settles down very quickly. Take some fluids, take some paracetamol, and you feel better. The most significant side effect is the allergic reactions, what we call anaphylaxis, where people have a very significant allergic reaction. This occurs within a few minutes of receiving the vaccine. And this is why when you get the COVID-19 vaccine, and indeed when you get the influenza vaccine, we require you to stay and be observed for 15 minutes, just to make sure that you don't have a significant allergic reaction to the vaccine. Now, there are some very, very rare side effects to the vaccines. As you've mentioned, the Pfizer vaccine has a very rare side effect called myocarditis, which is inflammation of the heart muscle. And the AstraZeneca vaccine has a very rare side effect, which is the clotting syndrome called thrombosis with thrombocytopenia syndrome.
Any cases of Pfizer vaccine side effects in Australia, Professor?
Yes, so we have reporting of side effects by the Therapeutic Goods Administration. So on their website, they report each week on side effects which have been reported related to the vaccines. Now, some of the side effects are just coincidental, and some of them are shown to be related to the vaccine. We have seen some cases of the myocarditis occurring in Australia. It usually occurs in young men, usually under the age of 30. It is usually mild and self-limiting, but we have had some people who've needed to be admitted to hospital with that side effect. So the issue, though, is that these side effects are also caused by COVID infection. So a lot of viral diseases cause myocarditis, and COVID-19 also can cause blood clots. And it's actually much, much more common that we see these symptoms occurring in people who've been infected with COVID-19 than in people who've been vaccinated. So it's actually preventing these side effects. The best thing we can do is to vaccinate people to prevent people from becoming unwell from COVID and getting these sorts of problems as well.
Thank you. Another question we received is, how effective are the vaccines? Is it possible to still be infected by the COVID-19 virus?
Yes, so the 3 vaccines we have available in Australia, the AstraZeneca, the Pfizer and the Moderna vaccines, are all very, very effective at preventing people from becoming seriously unwell if they're infected with COVID-19. And they dramatically reduce the risk of death from COVID-19. There is still the possibility that some people who've been fully vaccinated may be able to be infected with COVID-19, but that is far, far less likely than if you have not been vaccinated. And there is still the possibility that some people who've been fully vaccinated, if they are infected, may be able to transmit COVID-19 to another person. But again, that is far, far less likely amongst people who've been vaccinated compared to those who haven't. So what we're seeing at the moment, for example, in Sydney, is the vast majority of people who are being hospitalised with COVID-19, and the vast majority of people who end up in intensive care are people who have not been vaccinated at all. We've seen small numbers of people who've had 1 vaccine waiting for the 2nd dose, and we've seen very few amongst those who are fully vaccinated. So these vaccines, as I say, are very effective at preventing severe disease and the risk of death from COVID-19. And that's why it's so important that we are all individually vaccinated to protect us, but also to reduce the risk that we might, if we do come in contact with COVID-19, spread it to other people in our families and in the wider community.
So the message is, it is effective, go and get vaccinated.
Absolutely. Thank you, Elvis.
Another question we received, one of our viewer has asked why vaccine centers are insisting people sign a consent form before taking AstraZeneca, but not doing the same for Pfizer. Is it any true to this? I know some people who have been vaccinated with AstraZeneca and who have been vaccinated with Pfizer. I myself have been vaccinated, but I haven't signed any consent form. Could you clarify this issue for people who are listening to us?
Thank you, Elvis. So everyone who receives a vaccine is asked to provide their consent to be vaccinated. And usually when you receive the vaccine, the person who's giving you the vaccine will either talk to you about the vaccine and any side effects to look out for, or they may provide you with written material and then get you to sign a consent form. So you can give consent either verbally, just saying, yes, that's fine, I consent, and then that's documented by the person giving you the vaccine in their records, or you may sign a document saying, yes, I've read this. We've been particularly keen to have people getting the AstraZeneca vaccine read written material, just to reinforce to them that if they get unusual or persistent headaches or pain in the stomach in the 3 or 4 weeks after the vaccine, that they seek urgent medical attention, because that could indicate that they are developing the clotting syndrome that we talked about earlier. So that might be why you've seen a difference there. Everyone is giving consent, but in some cases it's just verbal by mouth. In some cases it's handwritten.
Thank you, Professor. Another viewer question asks, why are so many medical lecturers, doctors, virologists are being censored, made redundant, and deplatformed when they question or speak out critical against the data and research that are being provided by government health organization? Is there any truth to this claim, or does anything happen to doctors and broadcasters who spread misinformation?
So firstly, I am not aware of that happening in Australia. We encourage freedom of speech in Australia, including, of course, by our academics, and I'm an academic, I'm a professor at the Australian National University. But there is a distinction, though. If someone is a medical practitioner, if they are promoting things which are deemed to be not safe, then the Medical Board of Australia may actually look at what they're doing. But I'm not aware of that that happening, but that may be what your viewer is referring to. We have a lot of people who are scientists and clinicians, doctors and others who are talking in the media and providing advice, providing opinions, and doing an amazing job supporting the government, the national government, the governments in our states and territories in doing all that we can together to protect the health and well-being of the people of Australia. And there is new research coming out all the time about COVID-19. You have to remember, we've only been living with this virus for the last 18 months or so, since it first appeared in Wuhan in China at the very end of 2019, just the last few days of that year. So we're still learning a great deal, and our knowledge is changing as we learn more. We're also learning more, of course, as new variants of COVID-19 appear. This Delta variant, which we're currently tackling in Australia, in New South Wales, Victoria and the ACT, much more transmissible than the previous strains of COVID-19 we were dealing with last year, creating additional public health challenges and requiring different responses. We need our scientists and our clinicians working with us and helping us to interpret the findings that we're having from overseas and also from research.
Thank you, Professor. I'm asking all the questions that viewers have asked. I decided to ask one question from my side. I work at Youth Development Australia, and we have a program called Youth Works. We support vulnerable young people. So we are wondering whether the government has any plan to reach hard to reach vulnerable and homeless young people through programs like this and organizations that work directly with them.
Well, firstly, thank you for the work that you're doing, and thank you for the young people that you're supporting, especially young people who are in distress and in very difficult circumstances. It's absolutely imperative during this pandemic that nobody misses out on the health messages, on how to protect yourself, understanding about COVID-19, that people are aware of the public health measures which are in place to protect all of us, and that people get access to the protection being provided by vaccines. And so you're exactly right. The Australian government has been working with many peak organisations, working with those organisations and the leaders of those organisations to reach out to groups of people in our community who may have been missing out on some of the messages or may be missing out on the vaccines. We have at the national level an advisory group on working with culturally and linguistically diverse communities. We have an advisory group on working with Aboriginal and Torres Strait Islander people. We have an advisory group on working with people with disability who often have difficulty accessing health messaging. We have an advisory group on working with elderly people, and particularly people receiving aged care either at home or in residential aged care. We have a number of groups which bring together the leaders of those communities and the leaders of peak organisations. We also have an advisory group with young people of culturally and linguistically diverse backgrounds, because we recognise that the way of getting messages out to younger people in Australia is different to the way we're getting messages out to many older people. So thank you for the work that you're doing, and thank you for getting these messages out to vulnerable young people.
Thank you, Professor. One question I have, just a follow-up question to that. You mentioned about the advisory groups, different advisory groups with Indigenous communities, multicultural communities, and young people. Do these advisory groups provide advice to you or the Prime Minister and the Cabinet?
So the groups provide advice to the Department of Health and the Minister of Health, and then through the Minister of Health through to the Cabinet and the Prime Minister.
Thank you, Professor. The last question. Has the TGA approved any vaccines for young people aged 12 to 15 yet? What is the plan for how Australia will vaccine children as well as adults? And what is the likely timeline for full vaccination in Australia?
Yes, so the Therapeutic Goods Administration, the TGA, has approved both the Pfizer vaccine and the Moderna vaccine. It only happened last Saturday for use in those aged 12 to 15 years in Australia. As I mentioned, from the middle of September, we'll be taking bookings for those aged 12 to 15 to get the Pfizer vaccine. And then as the Moderna vaccine starts to arrive in Australia, it'll be arriving in the second half of this month, bookings will open for the Moderna vaccine as well. The Moderna and the Pfizer vaccines are very similar. They're both what we call mRNA vaccines and have very similar profile in protecting people. What we don't yet have is vaccines available for those under the age of 12. And indeed, there are no licensed vaccines for children under the age of 12 anywhere in the world at the moment, although there is a lot of research going on by the vaccine manufacturers around the world to see if the vaccines we're currently using are going to be safe and effective in younger children, or whether we're going to need the development of new vaccines to be used in those aged under 12.
Thank you, Professor. Thank you so much for joining us and answering some of the questions of our viewers and my question as well. And thank you, everyone, for listening to us and joining. Thank you.
Thank you.